Sometimes the vectors of life are lined up in your favor. Just from a simple blood draw to reevaluate Josh's methemoglobin level, the little boy started crying. And his tears are orange. This is a huge clinical clue that Josh's problem was because of a pharmaceutical toxin. Alex, come on.
One sec.
Come on, Alex.
Okay.
Got it. It's phenoxypyridine.
Phenoxypyridine? I mean, how's he getting phenoxypyridine? I mean, we're not even getting anything close to that. How is he getting a medication into his system that's not prescribed to a 5-year-old little boy?
Pharmacy mix-up?
I mean, doubtful. He's been in the controlled environment of a hospital. Something's not right here.
The blood flow looks normal, but her right ventricle is dilated.
Do you see a leak anywhere?
I can't see a problem with the tricuspid, but there are significant fat deposits on her heart and scar tissue.
In a 21-year-old, you'd expect a strong and healthy heart. Instead, what we found in Jessica was a very weak and dilated heart, and that affects the electrical conduction of the heart, and it frequently causes arrhythmias.
Whatever she has, it isn't new.
What are you thinking?
I need to do an EPS.
In an EPS study, or an electrical physiological study, we send a tiny jolt of electricity through a catheter into the heart. We look to see if the electricity is being conducted in a normal pattern or if it misfires.
Do you think she'll tolerate it?
Well, it's the only way to see exactly where her heart is failing.
Okay, buddy, I'm just gonna check on your IV, okay?
He's a big boy.
Awesome.
Right, Josh?
Hey, kiddo. So we have a pretty good handle on what's causing Josh's cyanosis at this point.
Aren't you going to do another tox screen?
Well, it's not really a matter of further studies at this point, okay?
You can't just send him home.
Well, you're right. There's still one more thing we want to check for before we do send him home, okay? John, can you send Josh down to the radiology suite for a stat ultrasound of his kidneys? Okay? You guys are more than welcome to go with Josh and Nurse John for this study. I want you to catch up with John. Have him make up some excuse why radiology can't take Josh at this moment. Okay, then come meet me back in the lab.
Proceeding to the heart.
On the monitor, we can determine if that electricity is going in the heart in a normal pattern or if it's misfiring.
And there's the problem right there.
If it's misfiring, it doesn't allow the heart to contract normally. Jessica Yang had arrhythmogenic right ventricular dysplasia, or ARVD.
This girl's lucky to be alive.
This is a genetic progressive condition which results in the accumulation of fatty deposits and fibrosis of the heart. When this happens, it doesn't allow the heart to contract and to beat normally. And this is, in fact, the cause of Jessica's seizures. ARVD is a common cause of sudden death in people under the age of 35. And in fact, 80% of people will die before it's diagnosed. I gotta go tell her parents. Your daughter has a heart condition called arrhythmogenic right ventricular dysplasia.
What?
Yes, she's had the condition from birth.
And as she's gotten older, more scar tissue has accumulated on her heart, not allowing it to beat as effectively.
But what about her seizures?
Exactly.
Her seizures actually threw us off course, but that was due to a lack of blood flow to her brain, essentially cutting off the oxygen to her brain. It may seem crazy to you, but for years she's been treated for the wrong condition.
That's impossible.
They felt that the diagnosis was wrong, but in fact it was just missed.
She says entire life she's been taking medication for seizures.
Yeah. So it was all a mistake?
Unfortunately, it was, but we have a way of treating it and fixing this condition, and that will also stop her seizures.
Josh is being exposed to a toxic substance, so there is a way to test for this, and it's a basic litmus test. It turns the litmus paper a different color when tested. This, if anything, has the most hope in solving this medical mystery.
Oh my God, it's positive.
So there was a reason why Josh decompensated every time we cured him with the methylene blue. It was a reason that I'm not sure we were all willing to accept at that point. I think it's time to call Dr. Garcia. It's a normal response for someone to feel disheartened when they think about someone poisoning the child.
Nikki, I can't find the applesauce. Where did you put it?
I packed it with the rest of your
Well,
things.
it's not in here and it's not on the table.
Well, I don't know where it is. We can get some more.
Miss Abbott, hi. There's someone I'd like you to speak with.
Oh, sure.
This is Dr. Garcia.
Hi. And what kind of doctor are you?
I'm a psychiatrist.